I wanted to review the most recent laboratory tests. The complete blood count did not reveal anemia. The CBC, or complete blood count, is a simple blood test that measures the number of red blood cells, white blood cells, and platelets. It's a common test. It's used as the first step to screen for a wide variety of medical conditions, including inflammatory diseases. The chemistry profile was noted without electrolyte abnormalities. The chemistry profile measures a variety of chemicals and enzymes, which are proteins that are involved in the body's chemical reactions. These are measured in the blood and provide very general information about the status of organ health and function, especially the liver, kidneys, and pancreas. The profile includes sodium, potassium, chloride, carbon dioxide, calcium, proteins, liver function tests, and blood glucose. The serum protein electrophoresis was normal. Serum protein electrophoresis is a test for measuring proteins in the blood. Elevated proteins can be found with multiple myeloma and other disorders of serum protein. These elevations can be found in patients with joint pain. The anti-neutrophilic cytoplasmic antibody, or otherwise called ANCA, is a blood test used by doctors to help with the diagnosis of autoimmune disease. It is commonly elevated in patients with granulomatosis, polyangiitis, and Sturge-Strauss disease. Elevations of this antibody may be found with joint pain. The uric acid level for gout was normal. The uric acid blood test, or otherwise known as the serum uric acid measurement, determines how much uric acid is present in the blood. It determines how well your body produces and removes uric acid. Most uric acid is dissolved in the blood, filtered through the kidneys, and expelled in the urine. Sometimes the body produces too much uric acid or doesn't filter out enough of it. Hyperuricemia is the name of the disorder that occurs when you have too much uric acid in the blood. High levels of uric acid are associated with a condition called gout. Gout is a form of arthritis that causes swelling of the joints, especially in the big feet and toes. The CPK test was within normal limits. CPK, which is also known as creatine phosphokinase, is an enzyme or protein, a protein that helps to elicit chemical changes in your body. It's found in the heart, brain, and skeletal muscles. When a muscle tissue is damaged, CPK leaks into your blood, and therefore high levels of CPK usually indicate some type of stress or injury to the heart or muscles. Elevated levels of CPK may be associated with muscle aches. The C-Reactive Protein, or index of inflammation, was normal. When there's inflammation in the body, the liver produces a protein called CRP. A high CRP indicates an inflammatory condition, including infection or inflammatory arthritis. For this reason, a high CRP is not necessarily a strong indicator of inflammatory arthritis specifically, but can support an inflammatory arthritis diagnosis. In addition to using CRP for diagnosis, doctors use this to test a patient's response to treatment. The ferritin level was normal. This is a test that may help figure out if there's too much iron. It can also be found in alcohol abuse, infection, liver, rheumatoid arthritis, and overactive thyroid, possibly cancer. It is a marker of inflammation and measures how much iron is stored in the body. High levels of ferritin combined with elevated iron levels have been found in patients with arthritis. The iron levels were normal. An iron level will tell you if you have too much or too little of this mineral in your system. It can occur in conditions like anemia. There are 3 different tests, which include the serum iron, which measures the iron in your blood, the total iron precocity, which measures how much transferrin of a protein that carries iron through the blood, and unsaturated iron binding capacity. The TSH, or thyroid, was within normal limits. A thyroid stimulating hormone measures the amount of thyroid in the blood. A TSH is produced by the pituitary gland, which is located at the base of your brain. It is responsible for regulating the amount of hormones released by the thyroid. Elevated levels of this hormone may be associated with joint aches and pains. The vitamin D level was within normal limits. Vitamin D is essential for strong bones because it helps the body use calcium from the diet. Also known as the sunshine vitamin, vitamin D is produced by the body in response to skin being exposed to sunlight. Low levels of vitamin D may be associated with aches and pains. The ANA antinuclear test for lupus was positive. This is a blood test that looks for antibodies to proteins found in the cell nucleus. The nucleus is essentially the brain center of any cell in the body. Many different types of proteins are found in the nucleus, and they can all be targets for an immune attack. This test is to see if there's antibodies in the blood that are attacking any proteins that are found in the nucleus. It is a screening test for autoimmune diseases such as lupus and other non-rheumatic diseases such as autoimmune hepatitis. It's not specific to a single disease, but a strongly positive ANA makes it more likely that a person has an autoimmune disease. However, it does not distinguish between different types of autoimmune disease. If the anti-ANA is positive, then there are clinical features of an autoimmune disease. Other more specific tests will be ordered. After the blood is drawn, it is sent to the lab where it is diluted with saline solution and tested for the presence of antinuclear antibodies. The rheumatoid factor was negative. A rheumatoid factor test measures the amount of rheumatoid in the blood. It is a blood test that looks for antibodies called rheumatoid factors. These are autoimmune antibodies produced by the immune system that can attack a variety of healthy cells. In early stages of rheumatoid, about half patients will have a positive rheumatoid factor test. The other half will have a negative. So having a negative rheumatoid factor test does not necessarily rule out rheumatoid arthritis. In established cases, 75 to 80% of patients will have a positive test. The anti-citrulline or CCP antibody was negative. This is an antibody test that looks for anti-CCP antibodies, or also called anti-citrulline protein antibodies, or ACPAs. These are a type of autoantibody, which is an antibody produced by the immune system that targets something that the body's own tissues are made of. It is present in about 60-70% of people who have rheumatoid factor. Not everyone with RA will test positive. Doctors need to interpret the results of this test in context with the other symptoms and the results of the other tests. Now, the SSA and SSA antibodies for Sjogren's were negative. Sjogren's syndrome is a condition characterized by dry eyes and dry mouth. At times, Sjogren's syndrome has been associated with joint aches. This is a marker in 70% of patients with Sjogren's will have this marker, and 40% will be for SSA, and 40% will be positive for SSB. Now, the ANA again was positive and can be found in lupus. But in this case, the lupus index was noted to be negative, which is less supportive of lupus. But the diagnosis of lupus depends on additional clinical criteria. So please call us if you have, or contact us if you have any of the following: hair loss, mouth ulcers, skin rashes, sensitivity to sun, joint swelling, joint pain, joint stiffness, ankle swelling, shortness of breath, chest pain, skin thickening, or bruising. Now, lupus is a condition that causes inflammation throughout the body. It is an autoimmune disease, which is a condition in which the body's own immune system is responsible for the inflammation and breakdown of its cells. This inflammation can manifest itself in various organs and tissues such as the joints, skin, heart, blood, lung, brain, and kidneys. And in the kidneys, it's called lupus nephritis. The symptoms of lupus may include fever, fatigue, body aches, joint pain, rashes, skin lesions, shortness of breath, chronic dry eyes, chest pain, headaches, confusion, memory loss. There's no specific test or imaging that we can use to diagnose lupus. Instead, we consider a person's sign and symptoms and rule out other potential conditions, although the ANA is not the specific test but can help us. And What we also use is laboratory tests, imaging tests, tissue biopsy, and possibly a kidney biopsy if we have any evidence that the lungs are affected. Lupus can produce a variety of symptoms in different individuals. It may take some time for a physician to actually make the diagnosis. Often a doctor will say that the lupus might be present, but that current symptoms are insufficient to signify a firm diagnosis. In this event, the physician will likely monitor the patient's signs, symptoms, lab tests closely over time, and have the patient return for regular visits. Now, the diagnosis of lupus, as I mentioned, no single finding qualifies as having lupus. The American College of Rheumatology has devised certain classification that 4 or more of specific criteria need to be present for a classification. Classification is not the same as diagnosis. Classification means that we have a certain certainty that lupus exists as far as its diagnosis for research purposes. The ACR criteria includes malar rash, which is butterfly cheeks, discoid, which is a scaly rash, photosensitivity, oral nasal ulcers, arthritis in multiple joints, serositis, inflammation of the lungs or heart, kidney disease, which is manifested by protein or blood cast cells in the urine, neurological disorders such as seizures and psychosis, and blood disorders such as certain types of anemia, low blood counts, and low lymph counts. Another organization called the Systemic Lupus Erythematosus International Collaborating Clinics, which is a group of rheumatologists and immunologists with interest in lupus, have developed another criteria, which, similar to the American College of Rheumatology, at least 4 need to be done. The SLIC criteria have at least 4 criteria. Each one needs to be clinical and one needs to be immunological, or we possess lupus nephritis by biopsy. This slide shows that the criteria that we use. Lupus types can be broken into several kinds, which include systemic lupus erythematosus, which can range from mild to severe. This is what we have been discussing, which is joint pain, skin rashes. There's also cutaneous lupus, which is generally limited to skin, can be scarring. There's drug-induced lupus, which is lupus induced by drugs. Neonatal lupus, which is extremely rare and affects infants whose mothers have lupus. Symptoms of this condition may include a skin rash, low blood cell count, liver problems after birth. Some lupus types have further divisions depending on a person's symptom. While there's no cure for lupus at this time, you can take medications to control lupus symptoms. Examples of lupus treatment include nonsteroidal anti-inflammatory agents, anti-malarial medication, DHEA, a male hormone that may help with hair loss, corticosteroids, immunosuppressive drugs, and a newer medication which is either an injection or infusion called Benlysta. A doctor will consider a patient's lupus symptoms and their severity when recommending lupus treatments. Doctors may recommend lifestyle changes such as avoiding excess ultraviolet sunlight exposure. Some people take supplements in addition to medications to reduce lupus symptoms. Concerning sunlight, people with lupus should avoid the sun since sunlight can cause rashes. A recommended skin blocker would be at least 70, and to make sure your sunscreen contains Helioplex. It's recommended you apply sunscreen to all parts of the body, even covered by your clothes, since most normal clothing items only protect your skin to a level of SPF 5. It would also be recommended to use hats. Now, one of the main medications for lupus is a medication called Plaquenil. This is used for mild SLE. Is an agent that has been used in the treatment of malaria, so it's also called an anti-malarial. It's taken in rare cases. It may affect the eyes, and it's recommended that an ophthalmologist see the patient for at least once a year who's taking this medication. In lupus, it is recommended a dosage of 200 to 400 milligrams daily. Doses above 400 milligrams a day are not recommended. The incidence of retinopathy or eye dysfunction has been reported to be higher when a maintenance dose is exceeded. There are other medications such as Benlysta, which is, as I mentioned, is an injection infusion, but we first try Plaquenil. Thank you.